Hi dear friend, today specifically I'm going to talk about health insurance, and the reason for this is actually quite simple. Um, this has to do with how we realize what kind of world we are in. When we were little, when we were children, or when you have children, you tell your children all kind of things that are half truths, maybe fully lies. It is not always very clear, but it is very interesting to see that most people are aware of the fact that when they are raising their kids, that they're saying kids that they're telling things to the kids which they know is actually not true. And the question is if that is morally acceptable or not. I'm a parent, so I struggle with the same thing, and this is also one of the reasons why I probably take this as a metaphor. Daoland. Hi dear friends of Daoland, welcome in this new video. My name is Yoli. I'm a 15th generation Wudang Daoist practitioner. I'm a disciple of Sifu Yo Xuande already since 1999. I'm not exactly sure which year anymore. It's already such a long time ago. And I have been studying with Master Liu a long time before that, and I am involved in all kind of translation projects for Daoist texts and so on. You can support this channel by liking and by leaving a comment, and you can of course support this channel even more by joining our classes, or maybe follow a course in Daoist medicine, or even as simple as natural beauty techniques with acupuncture, massage, food, medicine, and so on. Now, there's a lot of things you can do in this program. And the lead for this video I actually got from a Dutch comedy guy. Always a good source for new information. At the moment, when I was looking at that, he said, like, look, I sent my children to a public school because I wanted my kids to get to know about a lot of different kind of cultures and about a lot of different kind of religions. When they go to a particular religious school, they only get to see one ID, and as a result of that, their mind are going to be very numb. We all know this is the reality. When you raise people in a monotheistic system, whether it's communism or Christianity or Islam, you know that their mind is going to be closed off eventually for a particular kind of view, and you wanted to have an open view. Which is fair. But at a certain point, the children come back from school and they talk about God, they talk about Christ, they talk about creation and so on. And he didn't exactly know and understand how to respond to that because he himself was an atheist. I started out as an atheist anyway, and because of my association with Daoist, I could say that I am now a religious person in a particular kind of way, but I like to stay open-minded about all kind of things, and that's one of the premiums of Taoism, is that it's relatively open-minded about all kind of religions. But he said, like, how do I react on that? Because his child came home with the understanding that the world was created by God. And that is what children do, which he was also very aware of, namely that children are continuously seeking to understand things. They don't understand things very much. And as a result of that, they very quickly come to the wrong understanding because of their relatively simplistic understanding of reality. They get a little bit lost and they get carried away with things. So he didn't know what to do with that. And when we talk about health insurance, we have to deal with sort of the same thing. The idea is that if you buy a health insurance, you're going to insure yourself against the damages that can inflict upon your life in case you get sick or in case you get damaged by an accident or anything like that. And in many countries, that system has either not yet taken root, so there is not much of health insurance yet, or there is simply a system of insurance which is unfair. Like in my country, the insurance used to be a socialist-minded care, in the sense that the cost of the insurance should be carried by everyone, and as a result of that, the premium that people paid was very low, and people were fair, so they only used the insurance when they needed it. Then at a certain point, the government decided that insurance companies were a sort of semi-official thing that could charge whatever they want. So under the idea that competition would make cheaper prices, the premium insurance price, which was only a few euros per month, all of a sudden became a few hundred euros per month. And this is not something that happened all at once, but they started out immediately with a price which was at least 6 to 10 times higher than the premium that they paid under a national insurance. We had more competition, so we had more choice, but eventually we found out that there were only 4 companies. They were competing through, say, 20, 25 different offices that all had their own staff and they had to be paid. And that means that about 60% of all the premium basically went to the organization of the insurance companies, and all the rest was used for people's insurance. And there was a large discussion about having more choice and so on. But the thing is, what happened is because of the price, people were feeling that they were treated unfair. And as a result of that, they had to pay more money. They also wanted to have more in return. Because of having more in return, wanting to have more in return, they actually started abusing the insurance company, which made the insurance company more expensive. The whole system already was an abuse. And now at this moment you get into this cascade where everything becomes more and more expensive. People use more and more the insurance because if you pay premium price for something, you want value for your money. So if you have nothing, you just invent something that you have. And as a result of that, you can get something back in return. And now it is like that if you in my country you have an insurance, and especially when you take alternative insurance, for alternative medicine insurance, you get only like a benefit of a few hundred or maybe even 100 euros only on your whole premium for the whole year. So this is where it's gone wrong. In the Americas, it's even worse because the hospitals are able to charge whatever they want, and there's no real much of accountability for these hospitals, so they can charge thousands and thousands of euros or dollars for a operation or a procedure which should cost maybe only 25 or 30 dollars. For medicines which are available for the same medicines in another country for maybe 25 dollars, you pay $500-600 for that same medicine because they can charge it. There's no accountability for it, and there is no competition because the market is divided in such a way that people can charge whatever they want. In a country like China, it is a little bit different because there they have a sort of a savings account. When I lived there, I noticed from my friends that they had a savings account where they would have their insurance, but the insurance was an individual thing. So you would have to save from your salary so that you would have enough money on your account that in case you had something, you had saved something to treat your diseases with, because it costs money. You go into a Chinese hospital, the first thing you do is you pay your entry fee, then a fee for talking with the doctor, then a fee for your medication, and then a fee for collecting or something like this. You keep on paying fees, so you go all the time back to the cash register and you're being milked all the time. So it's just as unfair as the system in Europe, except that it was much cheaper than in Europe or America. Very much cheaper than in America. Even the VIP hospitals, which were charging sort of the same prices like Europe and the United States, even they were relatively, they were a little bit more cheaper than the hospitals. They were cheaper than the hospitals here. When you look at what happens in the insurance industry and the medical industry, is that now I'm following a little bit Michel Foucault, whom you might have read or whom you might not have read, but you should have read. In The Birth of the Clinic, he says at a certain point that the medical establishment, they took authority over our physical bodies. They took authority over the way how to perceive our body because of the scientific language, which was the new Latin, you can say, in the sense that they created an arcane language for which you had to study so many years at the university to be able to speak it, and then to translate that to us stupid people who don't know anything. So as a result of all this, the health insurance business and the medical business in general has become a little bit market-driven, pretty seriously market-driven, you can say. And there's another thing that is very often overlooked. The pollution caused by hospitals, doctors and so on altogether is a pretty big share of the national dirtbag business. Then there is the radioactive waste from hospitals, which is bigger in some countries than from their nuclear waste. So this is all really contributing a lot and is taxing society very much, but for which is not paid through our taxes, although our taxes also for medical care and social care are going up all the time. So you see that the medical care, the social care, all these kind of things, they're all being taxed higher and higher and higher to provide for a service, and the money is not spent wisely because it is not spent with a holistic perspective, nor is it spent in a social perspective where the people actually are being helped forward. They're being helped. That's basically it, because you see that the industry requires customers to be continuously come to be able to keep on running. So they do very little to actually help you get better, but they do continuously get you into new research, new testing, new programs, new medications, new operations, new procedures, so that you keep coming back. They all the time let you wait for a long time so that your disease escalates, so that you are required to have more dramatic procedures, which cost, of course, more money. So the more urgency you have for your disease, the more urgent it is, the more pricey the treatment will be. A lot of people, they go look for alternatives as a result of that. And that is a fair thing. I mean, if something is very expensive, you go look for an alternative. And you see that in the modern new age business, which is following the same capitalist principle of, trying to draw money from people. They are very often come with concepts and ideas which are also mysterious and arcane. A lot of this language is developed in the 1980s and the 1990s especially, where it became more common, like words like energy and divine and feminine power and all these kind of things. Things that were never really used in any ancient cultures, but now are basically standard. Not that all the ideas are to be disagreed with, but they also hide behind particular kind of spiritualized treatment methods. And these spiritualized treatment methods say that if you feel well, then you will be becoming well. That is actually a thought which is at the foundation of capitalism, namely positive thinking, which is also the foundation of New Age thinking, New Thought movement. And this positive thinking is that if you think positive, then that will be having a positive feedback on your body. And although positive thinking is, of course, giving you hope, it does not necessarily make you into a better person, because the chemistry of our body is in such that if you try to hack your system, your body gets used to it. So if you hack it once, it's fine. Like if you go to the gym and you take steroids for one time, that's fine. But if you take steroids for a second time, then at that moment you start to get addicted to it and you will need more to have the same effect. And that's the same like when you take heroin or when you take the antidepressants or any other kind of medication. So this is how the system works. It gets you all the time addicted to things that make you need more. And with spiritual techniques, the same. They make you give all kind of happy and blissful feelings, but these require all the time more. And as a result of that, you destabilize in your mind. You become more of a emotional, sensitive person, so that you're also more easy to be hurt, or you become more vulnerable in general. And as a result of that, you think you become more sensitive, while in fact you become more fragile, and you do not really strengthen yourself very much. Of course, the people who make the money, they do that. A nice example is the feng shui business. In the feng shui business, a lot of people, they prescribe all kind of changes to your house, hanging all kind of things, because they sell these things. They make all these nice schedules, and they don't take into account all the individual adaptations that have to be made because of your horoscope, because of your mentality, because of your personal development, the landscape, and so on. All these kind of things are sort of forgotten, and only for a very high price they are willing to do so. So then the people who can afford feng shui, they don't need feng shui because they already are successful. So the people who can afford real feng shui, they can afford, but they don't need it anymore because they're already successful. The thing is, when we talk about health insurance, this is not something you can buy. So feng shui, spiritual techniques, or medical techniques, they fall under the same chapter as the story of God fell for the child that came home. Some children, they don't have religion, and many people all over history, they didn't have religion as a whole, but they gradually found all kind of natural forces in nature, and they started pointing these out. In Neolithic times, we actually started creating science. Science is driven by our human need for knowledge, which starts in our childhood, and we try to collect knowledge more and more and more to make sense out of all this nonsense around us, and try to find meaning so that we can find our pathway, and that we can try to find a way to become successful human beings, which is defined by society, like what is successful, while in fact successful only means living happy, long, healthy lives. That's the only measure of success that you have. And that brings us to the fact that health insurance is a very important part, but not the industrial health insurance that you can buy, where you can buy off certain lack of luck or something like this, because that is what health insurance has been doing with people. It has made us vulnerable for damage, and then we have a dependency on an institution that can help us to create a sort of pseudo-health through which you can at least go on. Sociologists from the 1970s and 80s, they had a very clear idea that the whole point of medical care was nowadays just to keep you going back to the workplace so that you could help be productive for a company so they can make bigger profits. So in that light, you should see healthcare still up to this day in a way. You have to be productive, but you should not necessarily become a better person, because becoming a better person is an organic process and it takes time. And that brings me back to the idea that I had with the Daoland program a long time ago, and which I like you to opt in for, of course. I mean, I don't need to advertise that idea. I mean, this is just a selling point, which I think is self-evident, but a lot of people, they are not aware of it. So if you would like to help me out with this by making this available, this video available for a lot of people, that would be really great. But this is not my point right now. My point is right now that if you talk about health insurance, that is what you teach your children. This is also what you teach yourself, how you learn the skills and the manipulations of your body by the daily actions that you have, like your the kind of training that you have. Because if you go to the gym, you don't become any healthier. You boost your immune system, but you also create more heat in your body, which as a result could lead to chronic diseases, because all chronic diseases start with a low-grade infection and gradually build up to more serious aging problems. The way how we eat, yeah, sure, you can lesser your calories, but in the way how we eat and how we alternate between pleasure foods and health foods, you still start damaging your body and you still grow fat and you start aging because your body is gradually dehydrating. So when you look at healthcare, in effect, what you talk about is the healthcare that you can provide to yourself. The things that you can do by yourself to make sure that you become healthy, and the things that you can also pass on to your children so that they also can become healthy. A true healthcare is sort of a DIY project. Because at the moment when you are providing for yourself an understanding of your biology in a way which is understood in the language of experience, not in the language of science, but in the language of experience, because that language of experience you can share with anybody. And Chinese medicine traditionally is a language of experience. I know that modern TCM tries to put everything in this Western language concept, but it is actually anti-Chinese to do it like that, because the whole original Daoist idea is sure to make a connection with the divine, but definitely also to make a connection with the experience of people among each other and their place in the world at the same time. And it's not just the psychological or the spiritual aspect of giving meaning to your life, because every life has meaning because you are existing. There is no reason to feel sad about your existence or to be depressed because somebody doesn't approve of you, or somebody doesn't like you, or you don't like the food or anything like that. these kind of things in their superficiality just have to deal, they just deal with the fact that you are not aware of the fact that you actually exist. A lot of people, they live in a sort of zombie kind of existence, not in a negative sense, but that means that they haven't really chosen to be alive and they haven't really chosen to die. They are living somewhere in a sort of limbo, and this is where health insurance actually comes in, because health insurance is the knowledge that you gather that will help you to choose for life. And the whole Chinese medicine perspective, the Daoist medicine perspective in that sense, is that it is only natural to live as long as you can. And every time when you live a year longer, you get more information. You can adapt your self-experience more and more in such a degree that eventually you end up being an immortal. That's the promise anyway. So if that is an idea that you think like, actually that makes sense, then I think you are good material for the Daoland program. Because at this moment, this year, we are going to step outward with our Daoist medicine program. We have been test driving it now for a few years online, and we have all kind of short courses also, so that you can get to know who we are, what we are, how we do it. And we have weekly lessons you can participate in, everything for as low price as possible. The idea is namely that you should be able to spend something for learning, but you should not have to spend for it your whole life. You should have a value that is going to last the rest of your life and that you can share eventually with your children, with your family, with your friends, and maybe even become a teacher when you study long enough and intense enough that you have the right kind of values in you to be able to share that properly. All our programs are based on self-experience, and since it is rooted in Daoist medicine as a whole, it takes not only the Huangdi Neijing but also many other Daoist classics like the Huangting Neijing, and also well, a lot of material anyway from the Dao Zhang. Just at a moment like this, you lose out on titles in your head, of course. These are all things we translate ourselves, and within the students we test these things through exercises, or you continuously, through meditative practices, through movement practices, through observation practices, breathing practices, you test the theory continuously as a reality so that you can learn to manage your own body, your own health, and as a result of that have a good resource to understand what actually should be done for the clients that eventually are coming to you when you are ready for that. And actually in the study period as a whole, you have to start giving instruction to people and help people with all kind of things like, you know, looking young or losing weight and so on and so forth, to make sure that you start to get a good understanding what drives people and what makes people sick, age, and eventually die, so that you understand and the motivation in the biology, but also that you develop a compassion and a want to actually really help society as a whole as such. Because in the end, medicine is a political profession. It is an anti-establishment profession, but it is also an establishment profession in the sense that medicine is something that is there to help people forward and to be as available as possible, and not just to be very pricey. Therefore, also in our program, we have calculated how many students we need to be able to do this and this and this. We have to go through a certain kind of growth program, of course. But at the moment when that growth program becomes bigger, then that means that like when you are pouring sand on a hill, eventually it starts resettling itself, and then you get a different kind of financial calculation, and the prices can go down. So you can help already now by joining, making sure that eventually more and more people can study for less money, much less than a normal university would cost. We can work on the recognition of the program as a real autonomic university, which is of course a very important part, because alternative and natural medicine is usually not recognized. Not even in China, Chinese medicine is recognized fully as an independent profession, and this is what we work on. We want to work on the fact that Chinese medicine can be an independent science. It doesn't need Western science. It is nice to use as an illustration or as a contrast, but it should not be the heart of the medicine as it is currently in TCM. So when you think this is a good story, that people need a healthcare that actually really works, join us. And at least like and leave a comment about what you think, if you think this is a good idea. If possible, follow the links, sign up in one of the different levels that we offer participation in. And if participating is nothing for you, you can always sign up just as a sponsor for our program through the link that is at the end of the video, but also through our Patreon, which you will find the link for down at the bottom. Thank you very much for your free thinking and for participating in this video and thinking with me.